Welcome to our deep dive into the world of long-term care. You've shared some fascinating materials with me, and I have to say, getting into these training documents for nursing assistants, it's really given me a whole new perspective on what it takes to care for aging individuals.
It's so much more than just the medical side of things.
It really is. Our goal today is to distill the key takeaways from these documents about the aging process, the challenges elderly individuals face, and what best practices look like in long-term care.
Well, the things that struck me was how much emphasis is placed on the emotional and social well-being of those transitioning to long-term care.
Yeah, the documents actually refer to it as a human needs landscape. It's fascinating how they break down the transition. Like, did you know they specifically talk about the emotional impact of losing familiar surroundings and routines? Imagine how disorienting that must be.
Absolutely. And think about the losses people often experience during this transition. Loss of independence, loss of privacy, maybe even the loss of some cherished belongings. It's a huge adjustment.
And one thing that really stood out to me was this idea of becoming the person's memory from the Elements of Friendship handout. The idea that as memories fade, you can step in and become a sort of external memory bank for someone, helping them maintain a sense of self.
That's such a powerful concept, and it really gets to the heart of compassionate caregiving. It's about preserving someone's identity and dignity, even when their cognitive abilities are declining.
It's amazing how much these materials emphasize the importance of social connection and support networks. There's this extensive list of community resources, and some of them are pretty surprising. The Braille Institute makes sense, but the IRS.
It highlights the holistic approach to care these materials advocate for. They even mention fraternal organizations. It's about recognizing that well-being extends beyond the walls of a care facility. Financial security accessibility, social engagement, it all plays a role.
Speaking of specialized knowledge, there's a point where I almost got lost in a sea of medical terminology. Seriously, I thought I'd need a medical dictionary just to understand what these documents were talking about.
It can feel overwhelming, especially if you're not familiar with the jargon. But let's unpack some of the key terms that are particularly relevant to aging and long-term care. It might help us, and you, better understand the challenges many elderly individuals face.
Okay. Decode away. Now, I do remember one fundamental distinction from the source: anatomy versus physiology. Was it anatomy that's like a roadmap of the body?
Exactly. Anatomy is all about the structure, what things are called, where they're located. Physiology, on the other hand, is like the owner's manual. It's about how those structures function and work together to keep the body running.
So if anatomy tells us what the heart is, physiology tells us how it pumps blood.
You got it. And understanding both is crucial when we're talking about aging, because as we age, not only do our bodies change structurally, but the way our systems function also changes.
Okay, that makes sense. So let's talk about some of the conditions that are frequently encountered in long-term care. The source material mentions a whole bunch, but what are some of the ones that really stand out?
Well, osteoporosis is a big one. It's a condition where the bones become weak and brittle, which increases the risk of fractures, especially in the hips and spine. Another common issue is pressure ulcers, also known as bed sores, which are injuries to the skin caused by prolonged pressure on certain areas of the body.
And of course, we can't forget dementia, particularly Alzheimer's disease, which is sadly quite prevalent in long-term care settings. It's a bit sobering to think about.
It is, and it highlights the need for specialized care approaches for individuals facing these challenges. Understanding dementia, its progression, and the various ways it can manifest is essential for providing compassionate and effective care.
You know, what's interesting is that the source material doesn't just list these conditions. It actually dives into how various body systems change as we age. There's a whole section on it.
And it's full of insights that might surprise you. We often talk about things slowing down with age, but there are also subtle shifts in how different systems function. And those shifts can have a real impact on daily life and the kind of care that's needed.
There's this one detail that I found fascinating. The guide mentions decreased blood supply to the extremities as we age, which leads to reduced sensitivity to hot and cold. It seems like such a small thing.
But think about the implications. If someone can't accurately sense temperature, they could easily burn themselves or get frostbite without realizing it. Caregivers need to be extra cautious with bathwater heating pads, even just serving a cup of tea.
It really makes you think about all the things we take for granted in terms of our body's ability to sense and respond to the environment.
Absolutely. And as we delve deeper into these materials, we'll see how those seemingly small physiological changes can have a ripple effect on every aspect of care.
Well, since you brought up delving deeper, I'm ready to dive into one of the most prominent and maybe most concerning, aspects of aging covered in these materials. Alzheimer's disease.
Let's do it. It's a complex topic. But by understanding the different stages of Alzheimer's, we can gain valuable insights into the challenges and needs of individuals living with this condition.
Okay, lead the way.
The source material outlines 3 stages of Alzheimer's: mild, moderate, and severe, each with its own set of characteristic behavioral changes. Understanding these stages is key to tailoring care appropriately.
So what are some of the key things to look for in that initial mild stage?
Well, short-term memory loss is often one of the first signs. Someone might forget recent conversations, misplace items, or have trouble following a recipe.
It's those everyday tasks that start to become a little bit more difficult.
Exactly. And you might also notice some personality changes, increased irritability, anxiety, or withdrawal. Difficulty with tasks that require planning and organization is also common.
So it's not just about forgetting things. It's about changes in mood and behavior as well.
Right. And as the disease progresses to the moderate stage, those memory problems become more pronounced. Disorientation to time and place is common. You might see someone getting lost in familiar surroundings or forgetting what day it is.
It sounds incredibly disorienting, not just for the individual, but for those around them as well.
It is, and wandering and pacing also become common behaviors in the moderate stage. Another characteristic behavior is what's called sundowning.
Sundowning, what's that all about?
It refers to a pattern of increased confusion and agitation. That tends to occur in the late afternoon or evening. Researchers believe it's related to disruptions in the body's natural sleep-wake cycle.
So it's like the brain is getting its signals crossed as the day winds down.
That's a good way to put it. And then in the severe stage, the individual becomes completely dependent on others for care. They might lose the ability to communicate effectively, experience difficulty swallowing, and become more susceptible to infections.
It sounds heartbreaking to witness that level of decline.
It is. And it emphasizes the importance of specialized care approaches that focus on preserving dignity, comfort, and quality of life, even in the most advanced stages of the disease.
Going through the care guidelines in these materials, I was struck by how much thought goes into even the smallest details. Like there's a section that specifically mentions discouraging the use of plastic feeding utensils for Alzheimer's patients.
Yes. That's a great example of how subtle things can make a big difference. Apparently, plastic utensils can sometimes trigger negative associations or sensory aversions in individuals with dementia, perhaps because they evoke unpleasant memories or simply feel uncomfortable in the mouth.
Wow. It's incredible how much we need to consider when caring for someone with Alzheimer's.
It really underscores the importance of understanding the individual's experience, their unique needs and sensitivities. It's about stepping into their world, rather than trying to force them into ours.
Speaking of understanding the individual's experience, there's a technique highlighted in the source material called reality orientation to promote or maintain awareness. Can you explain what that's all about?
Sure. Reality orientation is a technique used to help individuals with dementia stay connected to their surroundings and reduce confusion. It involves consistently providing orienting information, such as the date, time, location, and the names of familiar people.
So it's like gently reminding them of where they are and who they're with.
Exactly. The idea is to ground them in reality and reduce anxiety and disorientation. The guide offers a ton of practical tips for implementing this technique, some of which might even be helpful outside of a professional caregiving setting.
Like what?
Well, maintaining a consistent daily routine, for example, that can provide a sense of predictability and security, not just for someone with dementia, but for anyone who thrives on structure.
Yeah, I definitely need my routines.
Another tip is using touch to communicate. For someone experiencing cognitive decline or sensory changes, a gentle touch can be incredibly reassuring and grounding.
It's like a nonverbal way of saying, I'm here with you, you're safe.
Precisely. And the guide suggests specific ways to use touch effectively. Holding someone's hand while you're talking to them, placing a hand on their shoulder when you're helping them stand up, or even just a light touch on the arm to get their attention.
I've noticed myself doing those things instinctively with my own aging relatives. But it's fascinating to see them presented as deliberate techniques within a professional caregiving framework. It's all about being intentional and mindful in those interactions.
And speaking of intentionality, the guide also emphasizes the power of encouraging reminiscing, especially for individuals with dementia.
I was intrigued by that too. It seems counterintuitive to focus on the past when someone is struggling to remember the present.
But as we age, the past often becomes more vivid than the present, especially for those experiencing memory loss. Encouraging reminiscing allows individuals to revisit cherished memories, reconnect with their sense of self, and even process unresolved emotions from the past.
It's like creating a space where those memories can be honored and shared. And it actually ties back to that earlier point about becoming the person's memory. By listening and engaging with their stories, we're helping them preserve their personal history.
That's beautifully put. It's a reminder that caregiving is about so much more than just meeting physical needs. It's about nurturing the soul.
Well, we've covered a lot of ground already, but I'm ready to dive into the nitty-gritty of daily caregiving.
Let's do it. I think you'll find this next section particularly interesting. These materials actually have a whole section dedicated to manual skills. It's like a how-to guide for day-to-day caregiving.
I was just getting to that. It seems like they really break down the practical aspects from assisting with daily activities to, like you mentioned earlier, using touch effectively as a communication tool.
You know, it's funny. I remember when my grandmother started needing more help, I'd instinctively reach for her hand when we talked. I didn't realize it was an actual technique until I saw it in these materials.
It's one of those things you just do right. But it's interesting to see the reasoning behind it. How touch can be so grounding and reassuring for someone experiencing cognitive decline or sensory changes.
It's almost like a nonverbal way of saying, I'm here, you're safe. And the guide even gives specific examples. Holding someone's hand during a conversation, a light touch on the arm to get their attention. It's about being present and connected in those small moments.
And it's not just about touch. The materials also talk about the power of reminiscing, especially for folks with dementia. But I have to admit I was a bit puzzled by that at first. Why focus on the past when someone is struggling with the present?
It seems counterintuitive. But think about it. As we get older, our past experiences often become more vivid, even as our short-term memory fades. And for someone with dementia, those memories can be a source of comfort and identity.
So it's like tapping into a part of their mind that's still vibrant and accessible.
Exactly. Reminiscing lets them revisit those cherished moments, reconnect with who they are at their core, and the guide suggests using prompts like old photographs or music to spark those memories. I can just imagine how powerful that must be.
It also makes me think about that becoming someone's memory concept we talked about earlier. By encouraging reminiscing, we're not just helping them remember, we're becoming part of that process of preserving their personal history. It's pretty profound when you think about it.
It really is. And it emphasizes that human connection. That sense of shared history and understanding is such a vital part of caregiving.
Okay, so we've talked about touch reminiscing. What other practical tips did you find particularly interesting?
One that stood out to me was the emphasis on routine. It seems obvious, but maintaining a consistent schedule for meals, bathing activities, it creates a sense of predictability and stability, which can be incredibly calming for someone experiencing cognitive decline.
I'm a big routine person myself. I can definitely see how disruptions would throw me off.
Yeah.
And for someone with dementia, those disruptions could be really unsettling.
Exactly. The materials even mention that seemingly small changes to the routine, like a different caregiver or a change in mealtime, can be disorienting. So the takeaway is consistency is key.
Now, I know we can't cover every single detail from these materials, but is there anything else that really jumped out at you in terms of practical caregiving tips?
Well, there's a section on validation therapy that I found particularly insightful. It's a communication approach that's really gaining traction in dementia care.
To be honest, I'm not entirely sure what that means. Validation therapy, is it like validating their feelings?
It's more than that. It's about meeting the person where they are in their reality, rather than trying to correct them or bring them back to ours.
So if someone believes they're still living in their childhood home, even though they've been in a care facility for years.
Instead of arguing with them, you acknowledge their feelings and try to understand their experience within that context.
It sounds like a pretty radical departure from the traditional approach, which often focuses on reality orientation.
It is, and it can be challenging. But the idea is that for someone with dementia, their internal world is just as real and valid as our external world. Trying to force them to conform to our reality can actually increase their anxiety and agitation.
I'm starting to see the logic here. If someone is already struggling with confusion and disorientation, constantly being corrected or contradicted would probably just make things worse.
Exactly. And it's not about agreeing with their delusions or hallucinations. It's about acknowledging the underlying emotions and needs they're expressing.
So if someone insists their deceased spouse is still alive, You wouldn't try to convince them otherwise.
You'd focus on the feelings of love and loss they're experiencing. You might say something like, "It sounds like you miss your spouse very much." It's about connecting on an emotional level, rather than getting bogged down in the factual accuracy of their statements.
Wow, this is really making me rethink how I approach conversations with people experiencing dementia. It's a reminder that compassion and empathy are just as important as knowledge and facts.
Absolutely. And that leads us perfectly into the next section of our deep dive. A closer look at these specific changes that occur in various body systems as we age.
Let's do it. I'm ready to unpack all those fascinating details about the aging body.
All right, buckle up. We're about to embark on a journey through the inner workings of the aging human body. And trust me, there are some surprises in store.
I'm all ears.
Yeah.
Let's start with something we can all relate to. Changes in the skin. It's one of those visible signs of aging after all.
Absolutely. And the source material points out that as we age, the skin naturally becomes thinner, more fragile, and less elastic. It's what gives us those wrinkles and fine lines.
But it's more than just a cosmetic change, right?
Ah.
I mean, I know older adults are more susceptible to bruising and things like that.
You're right. It's not just about aesthetics. That thinning skin, along with reduced blood flow, makes older adults more vulnerable to cuts, tears, and bruises. And remember that detail we mentioned earlier about decreased sensitivity to temperature?
The one about potential burns and frostbite?
Exactly. It all ties back to those changes in the skin. Caregivers really need to be mindful of things like bathwater temperature, sun exposure, even the types of fabrics that come in contact with the skin.
It's like we need to develop a heightened awareness of their physical environment and how they experience it.
Precisely. And that awareness extends to all aspects of care. We need to consider everything from the temperature of their room to the type of lotion we use on their skin.
Speaking of changes in the body, what about the urinary system? That's something that often comes up in conversations about aging. I mean, I've heard those gotta-go moments tend to become more frequent.
You're not wrong. The source material addresses this directly. It explains that as we age, the kidneys become less efficient at filtering waste products from the blood, and the bladder loses some of its capacity and tone, which can lead to increased frequency and urgency of urination.
So it's not just a matter of drinking less coffee before bed.
Unfortunately not. Although staying hydrated is still crucial for overall health. Those changes in the urinary system are a natural part of aging.
And for some individuals, it can lead to incontinence, which I imagine can be quite distressing.
It absolutely can be. And it highlights the importance of compassionate and understanding care. No one should feel ashamed or embarrassed about age-related changes to their body.
Well said. Now let's shift gears a bit and talk about the musculoskeletal system, those bones, muscles, and joints that keep us moving and grooving.
Ah, yes. This is where we see those classic signs of aging: decreased muscle mass and strength, stiffening of the joints, and as we mentioned earlier, that increased risk of osteoporosis.
I remember my grandmother used to say she was shrinking as she got older. Was she actually getting shorter? Or is that just an old wives' tale?
Well, there's actually some truth to it. As we age, the cartilage in our joints wears down, and the bones in our spine can compress, which can lead to a slight decrease in height. It's not just about posture.
Wow, I had no idea. But the bigger concern, I imagine, is that increased risk of falls.
Absolutely. As bones become more brittle and muscles weaken, falls become a much more serious threat. A simple stumble that might have resulted in a bruise for a younger person could lead to a broken hip or wrist for someone with osteoporosis.
It's a stark reminder of how even seemingly minor injuries can have major consequences as we age.
And it underscores the importance of preventive measures like weight-bearing exercise to maintain bone density, fall prevention strategies, and of course, creating a safe environment to minimize trip hazards.
Now, what about changes in the digestive system? I've heard that digestion slows down as we get older, which is why older adults tend to prefer lighter meals.
There's some truth to that. The muscles in the digestive tract can lose some of their strength and tone, which can slow down the movement of food through the system. This can lead to digestive discomfort, constipation, and other issues.
So it's like a traffic jam in the intestines.
You could say that. And that slowing down can also affect how medications are absorbed, which is something caregivers need to be aware of.
It's amazing how much we take our digestive system for granted until it starts acting up.
It really is. And these changes highlight the importance of supporting good digestion throughout life. Eating a balanced diet, staying hydrated, and managing any underlying digestive conditions can make a big difference.
Now, I know this next topic might be a little sensitive, but it's something we need to address. Changes in the reproductive system.
Right. The materials don't shy away from this topic. They acknowledge that both men and women experience hormonal shifts as they age, and these shifts can have a range of effects on physical and emotional well-being.
For women, of course, there's menopause, which is a huge life transition. It's not just about the end of menstruation. It's a hormonal roller coaster that can impact everything from sleep to mood to energy levels.
Absolutely. Hot flashes, night sweats, mood swings. These are all common experiences during menopause. And for some women, the decline in estrogen production can lead to bone loss and an increased risk of osteoporosis.
It's incredible how all these body systems are interconnected. A change in one area can trigger a cascade of effects throughout the body.
Exactly. And this interconnectedness underscores the importance of a holistic approach to care. We need to consider the whole person, not just their individual symptoms.
Well, we've explored a lot of territory today, from the skin to the digestive system to the reproductive system. But I'm saving the most complex system for last, the nervous system, the command center of the body.
This is where we see some of the most profound changes associated with aging, both in terms of physical structure and cognitive function. And it's where we really need to start thinking about brain health.
I've heard that the brain actually shrinks as we age. Is that true, or is it just an old wives' tale?
It's true, but to a certain extent. Some degree of brain shrinkage is a normal part of aging. However, in conditions like Alzheimer's disease, this shrinkage can be much more pronounced and can affect cognitive function.
So those senior moments we often joke about, they might actually have a biological basis.
In many cases, yes. But it's important to remember that not all cognitive decline is inevitable. There are things we can do throughout our lives to support brain health, such as staying mentally and physically active, engaging in social activities, and managing chronic health conditions.
So it's not all doom and gloom.
Definitely not. But it is important to be aware of the potential changes that can occur, and to seek medical attention if you notice any significant cognitive decline that's interfering with daily life.
Okay, good to know. Now, what about those sensory changes we often associate with aging? Like, I know a lot of older adults need reading glasses. What's going on there?
It's all about the lens of the eye. As we age, the lens becomes less flexible, making it harder to focus on objects up close. That's why reading glasses become necessary for many people.
So it's not just about the print getting smaller.
Right. And then there's age-related macular degeneration, a leading cause of vision loss in older adults. It affects the central part of the retina, making it difficult to see fine details and colors.
That sounds serious.
It can be, but early detection and treatment can make a big difference in preserving vision.
And what about hearing loss? I know a lot of people just assume it's a natural part of aging, but is there more to it than that?
There's a lot going on. Those tiny hair cells in the inner ear, which are responsible for transmitting sound signals to the brain, can become damaged over time, leading to difficulty hearing high-pitched sounds, understanding speech in noisy environments, and even experiencing ringing in the ears known as tinnitus.
It sounds like aging is a symphony of sensory changes.
You could say that. And these changes can impact an individual's quality of life in profound ways. It's not just about turning up the TV volume. It's about understanding the challenges and finding ways to support communication and social interaction.
It's about creating an environment where they feel included and engaged,
Yeah.
despite those sensory limitations.
Exactly. It's all about adapting and finding ways to make the most of each stage of life. And that's where compassionate care and a deep understanding of the aging process really come into play.
Wow, this deep dive has really been an eye-opener. I feel like I've gained a whole new understanding of what it means to age, both physically and emotionally.
It's a journey, isn't it? And I think these materials do a fantastic job of highlighting the complexities of that journey and the importance of approaching aging with a holistic perspective.
We've covered a lot of ground, from the human needs landscape to the intricacies of the aging body to those really practical caregiving techniques. I feel like I'm walking away with a toolbox full of insights and strategies.
I love that analogy. And it's so true. Caregiving is a skill. And like any skill, it requires knowledge practice and a willingness to adapt and learn.
One of the things that keeps coming back to me is that idea of honoring the personhood within each individual. No matter what stage of life they're in, it's easy to get caught up in the medical diagnoses or the limitations that come with aging. But it's essential to remember that we're dealing with human beings, with rich histories and unique perspectives.
Absolutely. And those histories and perspectives become even more important as we age. Those memories, those stories, those relationships, they're what shape our identity and give our lives meaning.
It's making me think about that becoming someone's memory concept again. It's such a powerful way to think about caregiving. We're not just providing physical care. We're helping to preserve someone's legacy, their sense of self.
That's beautifully said, and it highlights the profound responsibility and privilege that come with caring for those in their later years.
Going through these materials has really challenged my preconceived notions about long-term care. I used to think of it as a place where people go to be looked after,
Hmm.
but it's so much more than that.
It's a community, a place where people can connect, find purpose, and experience joy, even in the face of challenges. And those connections, those moments of shared laughter or quiet companionship, they're what make life worth living at any age.
And it's not just about the residents. It's about the caregivers, too. I have so much admiration for the people who dedicate their lives to this work. It requires a unique blend of compassion, patience, and resilience.
It does, and I think those qualities are reflected in these training materials. There's a real emphasis on empathy understanding and the importance of meeting each individual's needs with dignity and respect.
Before we wrap up this deep dive, I wanted to revisit one topic that really got me thinking: validation therapy. It seems like such a radical approach, especially when we're so often told to correct or redirect individuals with dementia when they're confused or disoriented.
It is a different way of thinking about communication, isn't it? But the more I learn about validation therapy, the more sense it makes. It's about shifting our perspective from fixing the person to understanding their experience.
And it's not about indulging delusions or pretending that reality isn't real. It's about acknowledging the emotions and needs behind those expressions.
Exactly. It's about saying, I see you, I hear you, and your feelings are valid, even if I don't share your perception of reality.
But what about those situations where someone's reality poses a safety risk or is disruptive to others? How do you balance validation with the need for boundaries and intervention?
That's a great question, and it's something that caregivers grapple with all the time. It's about finding that delicate balance between respecting the individual's autonomy and ensuring their safety, as well as the safety of those around them.
It's not always easy, and there's no one-size-fits-all answer. But I think the key is to approach each situation with compassion and understanding, and to be willing to adapt our approach based on the individual's needs and the circumstances.
I couldn't agree more, and I think it's a testament to the complexity and nuance of caregiving. There's always more to learn, more perspectives to consider, and more ways to grow in our understanding of aging and dementia.
Well, I think we've reached the end of our deep dive. I want to thank you for joining me on this exploration of long-term care and the aging body. It's been an incredible learning experience for me, and I hope our listeners feel similarly equipped to navigate this complex and rewarding terrain.
It's been my pleasure. And remember, this is just the beginning. There's a whole world of knowledge and resources out there, and I encourage you to continue exploring and advocating for compassionate and informed care for all individuals in their later years.
And remember, there's always more to learn, more perspectives to consider, and more ways to make a difference in the lives of those we care for. Until next time, keep diving deep.